Hi, welcome to Community Insight. I am your host, Reverend Dr. Rodney Coles. Community Insight is information given to our community, sharing information with you with what's going on in the community, and you can bring back with you. Today, we have a special guest here on our show from Project Amet Project, and I'm going to let her introduce who she is and give the mission statement. Please welcome to the show.
Hi, thank you so much, Pastor Coles, and I appreciate the opportunity to be on here today. I'm Madia. I'm the Project Men Social Work Case Manager with Access East that is administered under the Health Assist program. I am truly honored and blessed to be in this position because truly it's ministry in terms of helping those that are currently have no access to health insurance or adequate care receive the services that they need. So the mission of Men or Project Men that is administered under the Health Assist program. Really, their mission is to partner with faith-based organizations, healthcare providers, and other community organizations in coming together to really build a safety net that makes people feel comfortable with coming to us to receive resources or the access to the care that they need through our 3 free local clinics that we currently have in Pitt County. With Project Men, we really work with working towards effective care coordination through the volunteers. We have the medical students, we have healthcare providers, nurses at like the Oakmont Clinic, interpreters, all these individuals coming together, seeing it as ministry to help those that are in need. Project Men really works around those that currently, like I stated before, don't have access to health insurance, those that have fallen in the gaps. And can't receive the routine care that they need. And so what does that look like for an individual that's without to really be given the care that they need? And so through these 3 free local clinics, and we have one at the Greenville Community Shelter, Crossroads Shelter, we have one at Oakmont Baptist Church, and we also have one at the Pitt County Health Department. And through these clinics, people are able to come see physicians and really be linked to the services that they need to get effective diagnoses or whatever the case may be to get what they need.
So let me just recap just a little bit.
Okay.
So it's a free, you have professional doctors on staff that actually help doing the faith base that help folks that may needs medical attention that don't have insurance.
Right.
And of course, you also mentioned that you have some partnerships, and we also know we can always use more partnership. It's never
Absolutely.
enough. You can't drain them out like a grape turned to a raisin. You keep on draining them out. But so if somebody like you mentioned Oakmont Baptist Church, and I know they do a lot of things.
Yes.
Let me just ask you some challenging questions.
Okay.
And I know, and I'm going to speak. One of the biggest problems, and I find with us males, I'm putting us males up there. For some reason, we don't feel that we need to go to the doctor to get checked for either prostates or things like that. Do you run to some of those that like trying to get the males that go to the clinics more to get themselves checked out?
I think in terms of demographic population or male versus female, honestly, we don't really see a challenge in that. I think the challenge really comes from people not knowing that the resources exist or that it's important to receive or to get a checkup and to check for your well screening needs. I think either population we had a community event this past weekend, and we encountered an individual who, was kind of unaware of the importance of blood pressure and what that meant. Mm-hmm. And so I think it's really, you don't know what you don't know. And so whether it's male, female, no matter the race, or I think it's just really having the awareness of the importance of getting the adequate care that you need.
And you provide that because there's no excuse for them not to get to get a checkup. There's no really excuse when you providing information for them and to say, well, listen, I could go to Oakmont Baptist. And I will admit this on air. I got in trouble from my own personal doctor, and his name is Dr. Gary Jones. And, and he what happened is I had an appointment, and I've just come to another time, and they find me. I came in, they find me, and my doctor said, Rodney, listen, I paid the fine. I said, what in the world? Now you want to see me? You just find me. I don't even feel good, It's like, hey, I came in, he said, Rodney, I'm going to remove the fine. But the point is that your health is very important.
Absolutely.
You may be doing, I know what you're doing in the community. That's all good and well. But you got to come to your appointments and get checked out. And he made a good point. And then there's a doctor, Dr. Steve Ferguson, and he's a gentleman. He's in his own practice in Bertie,
Okay.
and he owns his own practice. And just speaking with him, and he said some things to me. A lot of times we don't have it right, and we really need to go to the doctor to get more of understanding. And he hit me with, you need to eat. You need to eat in the morning time. I think that I run around all day long without eating. I'm doing right, and then you're not. And you have free health cares for folks to go to and say, listen, to get checked out.
Right.
And I'm speaking for Mel, because I know that my wife, she goes to the hospital all the time. I mean, every time you turn around, she's making sure everything's all right. But I'm speaking for myself. For a lot of men don't go, and this is like to be a wake-up call to them. It's amazing. We will take care of our vehicle, and I'm number one, and all change in the car, or I run to the GM dealer, time for my oil change. But to take care of our health is very important. Absolutely. And knowing that there's programs out here like Project Med to help us when you don't have no insurance.
Right.
And I know the folks looking at this broadcast saying, well, listen, this is a time for them to get off that couch
Absolutely.
and get checked out. And it's not costing them nothing because, they never know what might be going on that could be prevented.
Right.
And they keep moving on.
Right.
You understand? So what would you try to share with them and, try to get them more involved and coming to these clinics and the time and, and effort? What's your thoughts on getting them more involved and coming to the clinics?
I believe, the person definitely has to have a willingness to want to be there.
Mm-hmm.
But, and just to provide some comfort, as you mentioned, when we think about healthcare and the cost of healthcare, one thing that's a blessing through these free clinics is that it is free for them to see a physician and you think about a typical copay for someone who may not have insurance. You may be looking at $75 copay versus you coming to the free clinic and it's free. Even through Project Med and through our Health Assist program, and just to briefly mention, our Health Assist program really provides the opportunity for us to link individuals to specialists at a low to reduced cost. And so with that opportunity, you think about going to a specialist, and that will cost you maybe $150 without insurance. But coming to the free clinic, we may be able to get you that for $30 copay. And so really being comforted in knowing that you don't have to come out of your pocket, or that there's resources out there that would meet your need or meet you where you are in terms of getting your healthcare needs met. And so I think that's really important, and which I think is tremendous about this program. It makes it really extraordinary to understand that these people are volunteering their time. They really care about your healthcare needs. And so those are like, oh, I don't care. There's people out there that care about you, and want to see you be well. And so that's the blessing in the free clinics. It's definitely a cost saver for those that may not be able to afford it.
They save money, they get information. I like how you just mentioned that. And I think all the providers who's actually taking their time, that's the ministry.
Right.
Because they say they taking their time to come out to make sure you're okay, and they couldn't get paid for that.
Right.
So they giving back to the community by helping them, and really need to have them to come to these free clinics. If somebody needs to get to the free clinic, is there a website or something they need to go to, or there's a phone number that they could contact? Because I know there's folks looking at this broadcast, they need information, they need more information. Well, I hear about y'all talking about the free clinic, but how do you get to the free clinic, and what you have to do? Do you have to have ID and all that? I mean, what is really, let's first go, what is the qualification for someone other than being alive to come to the free clinic?
Gotcha. For the free clinic, there's no, at least for the health department clinic and the Greenville Shelter Clinic, there's really no criteria that you have to meet in order to be seen there, which is great. Even those that may be underinsured, if you have some type of, the clinics will see you regardless. Because we know some people, it may be a toss-up between, do I buy a loaf of bread or do I buy my medicines? And so we never want to see anybody in that predicament. And so the clinics will pretty much see who they need to make sure that their needs are being met. In order to get involved with the free clinics, or if you have questions about the free clinic, I think the best thing to do would be either to contact me or our Health Assist main line. And my number is 252-847-7016. And then our Health Assist main line, in case they have just general questions about our program, is 847-2821. Each individual clinic does have their individual websites. The Oakmont Baptist Church has all the information about their free clinic on their website. And I'd be more than happy to provide that information if someone were to give me a call and ask questions. And the two clinics that are led by the med students also as well have their own website. But the best way would probably be to contact myself.
Health Assist does a whole lot. You're more than just Project Med. Could you want to elaborate a little bit on what all that you do? I know that's your main focus, but they need to know what exactly you do. Y'all do a whole lot, and I'm honored to sit there with Dr. Tom Ines and that committee that they put together. Could you explain to the audience what exactly, just a little bit about the Health Med, what exactly you do?
Absolutely. So the Health Assist program, which is under the Access East umbrella, as I stated before, it really allows the opportunity to provide individuals with specialty care at a low to reduced cost. But with that program, we've also been, through the partnership with Dr. Irons and the health department and things like that, we've been in Greene County Healthcare has been a tremendous partner in the work that we do. We've been able to use Greene County Healthcare as a way to link our patients to primary care. And so if they become a little too complicated for the free clinics, we're able to call Bernstein or Snow Hill Medical to get them appointments so that they can start establishing that continuity of care that they may need if they have chronic diabetes or hypertension. So Greene County Healthcare is a huge partner in the work that we do. And through Health Assist, we also have what we call our medication assistance program. Through our medication assistance program, we're able to link those that may be on several medicines, link them to our prescription assistance program so that they can receive their medicines for free. And oftentimes we try to do that with everyone, even if they're on one or two medicines, just so that one, it's free, and then most of the time the medicines get mailed directly to them. And so we really take the time with our program to partner with the providers to say, hey, how long do you think this patient might be on this medicine? What do you think about linking them to the prescription assistance program so that they can receive this medicine for long term? And then it's free to the patient. Wow. So that's been a tremendous part of our program. And then, in addition to with the Health Assist program, really, we are case managers that really try to help individuals navigate through community resources. And so really taking a holistic view of the patient to say, hey, what is it that you need? You know what? Let me call Pastor Coles because I believe his ministry is doing that. Or let me, because we've had to help people, we understand that they may need their basic needs met. And so what's a great thing about, like, for instance, with the Oakmont Clinic is that they sometimes have a food drive while they're having their medical clinic. And so just having those resources and understanding what resources are out there, then we're able to help provide that, give that information to the patient as well. And so Health Assist, we really take the time to take a holistic view. There's 6 of us, and so, I'm with the free clinics. We have Lynn Howard, who's at the Bernstein case manager there, Lisa Clemens Boyd, who was at Snow Hill Medical, and then our 2 medication assistance technicians, Crystal Jackson and Alexis Inman. But we're all in Chantel Cheek, who is our director, and she's also a nurse and the case manager at the Agape Clinic in Beaufort. With the Health Assist program, it does service Pitt, Greene, and Beaufort County. Now, the free clinics don't limit you, whatever county you're from, you're more than welcome to come to the free clinics. But the Health Assist program does work with individuals from Pitt, Greene, and Beaufort County. And so it's been a tremendous opportunity. It's a great program to be a part of.
I know people probably looking at this broadcast now and not realize all that Health Assist offers in your community. And when you mention Agape, I know Reverend David Moore Clinic, he has there in Martin County. And this broadcast hits all these areas that we are talking about right now, and knowing where they can get help. There's no really excuse. I look in the biblical scripture in the book of Hebrew 10:26. It says, once you know the truth, there's no sacrifice for your sins. Once you really know the truth on what you can do to help yourself or whatever. And a lot of people, they make excuses where not to get help. Mm-hmm. And hearing about health assistant, I know I've been sitting there for a little time now, knowing that y'all guys do some fantastic work in reaching the community, and it's really, they need to know what y'all do. They need to know where y'all located at, and having that phone number to be able to reach the people that's just looking at this broadcast right now and saying, well, Link, you may have an issue where, she couldn't have said it better. Well, should I get my food or should I take my medicine? Here you go. They work with resources to help you find that information and make those connections. And then even saying that they will even mail it to your door. I mean, I don't have to burn no gas. I don't need to get up. I can stay in my pajamas all day, you know what I'm saying, and get my free medication. Amen, somebody. So it's amazing what y'all do over there. And I mean, I'm so glad to be a part of it. You have a great team, that how y'all work together, how you get things out. You just did a large drive early this year. I think it was this year. I think it was in March at Cornelius Church, Bishop Rose O'Neal, and helping with all information. Y'all do a whole lot in the community, and I implore all of y'all what y'all do out there to bring that information to the community. And I know there may be some providers on this looking at this broadcast. As she said, they're using their time. If you're a provider, you know that, listen, there's a Saturday once a month or once a year you could come and help with them. They need to get in contact, because, one of the biggest problems in the free clinic, you burn people out eventually if you got the same people over and over again. And it's good to have more people get involved. I'm quite sure they probably need to get up with Dr. Tommy on, but, they can go to the health assistant and ask what they can do to help. You know what I mean? Tying is more than money. You got to tie your time, you know what I'm saying? And helping somebody and giving. Most people don't understand that. I'm about to get biblical on them. But, but the understanding that the program that you guys have to help folks and the way you lead it. Let me ask you this question to get right back to you for a moment. I'm a church, and would you do a presentation for my church and to give my church information and get more involved? Because there's a lot of your pastors and this organization looking at this broadcast and say, well, you can't get everything we saying on the broadcast. You're going to mess up the story. So bring them in. Would you come and speak to the audience, to the people or the church or whatever? Would you be able to do that for us?
Absolutely, and that's one of the main objectives of the MEND program, is to really partner with the faith-based organizations, because we know, there's members of the community and the congregation that come to you for help or assistance to meet their healthcare needs, and so really having the MEND project bridge with the churches to help meet the needs of the community is really the idea or the mission of MEND, to work together collaboratively to really focus on the people. And so so you have done a couple of presentations so far. We're looking to partner. St. James and St. Peter's currently already participate with our program, which has been an amazing and a tremendous blessing to the program. It's how we've been able to, get some of our medicines and things of that nature. So we are looking to partner with more churches in the community to definitely Oakmont, of course, is a huge partner in providing their own clinic and allowing us to be there to help serve the people. So that getting with the churches, I would love to come out to any ministry to give a presentation and really sit down and talk through, what does it look like for us to partner to serve their people.
Wow. Let me just ask this question. I don't know whether you'd be able to answer this or not, but I'm going to put it out there. What happens if a church want to make a donation or something, because we need physical bodies. And, I can't, because I got to go to the Lord get some gas, and I can't say that Jesus paid the price. I got to get my credit card, I mean, so we know that it does take, most people don't understand. Even Jesus had money. He had a treasure. That was Judah. But the point is that if somebody want to make a donation at a church or anyone, because, I mean, we not prejudiced. Everybody want to donate their money. You know what I'm saying? But if somebody want to make a donation, is that something they want to say, well, I can't spend my time, but I can help because it's helping people. Is there an area for them to do that?
Absolutely. Donations we welcome, of course. And the best way to do that is check can be payable to Access East, and just in the memo line put Health Assist /MEND. but we definitely welcome donations for it. It's a great way for us to assist us in what we're doing for the community.
Now, is there a website? I mean, would you know the website and the phone number? Because we got to keep on telling, because you know how people, they see in this broadcast and my ink just went out, just went out. It's almost like you're trying to eat your lunch and nobody's around you, and so you take a bite, the phone start to ring. Is there the number and the website? Because there may be some folks looking at this broadcast, and we all got a smartphone, and we just said, okay, Google, give me this here. But is there a website that they can look at and get more information to take back to themselves as they're looking at this broadcast?
Absolutely. You can visit accesseast.org. And give us a call again on our main Health Assist line at 847-2821. Or, of course, you can contact me directly at 252-847-7016.
Yeah, you shared a lot of information on today to really speak about those who you may be going through right now. You may be sitting and watching this broadcast, and you see you got clinics in Martin County, Beaufort County, Pitt County, and we also know in Greene County you work with, and working with the churches. And we really need to get the churches more involved in health, because you know what? Listen, we all got to leave, but we have to leave before our time. You know what I'm saying? Absolutely. If we at least get checked out, as the first time we do know that God brought Lazarus from the grave, but the second time the Undertaker took him. You know what I'm saying? But we know we're going to leave. But if you're looking at this broadcast, churches and pastors, and what can you do to help? How can you get this information? She's gave us a lot of information to bring back to the church, whether you could donate. Even there may be providers that's watching this broadcast. We got to help our church members, because, like I said, I raised my hand up already. Told you I messed up. I mean, I'm not afraid to tell you that I have messed up and not going to the doctor myself. And my doctor, He did the right thing. I'm glad that he fined me for that, because he made me think that, listen, take care of your health, Rodney. Your health got to be taken care of. It doesn't matter what you do every day, but you got to come to the doctor. You got to make your appointments. And since then, I never missed an appointment since, and I've been feeling better, and let me know where I'm at and know about my BMIs and everything he needs to tell me. Understand? And here there's an opportunity. We have insurance, so we have to pay each time I go. When they take a little blood, that's a charge. When they give me medicine, it's a charge. So we actually have a credit card. My wife had just to pay for the medicine. And here there's an opportunity where y'all can get free medicine if you qualify for it. Again, I don't think Donald Trump would qualify for it, but if you qualify for it, this is an opportunity for them to get in contact with you, and to even churches that need to get a presentation. You said, I would do a presentation in the church.
Absolutely.
You know what I'm saying? Explain to them and what they need to do to help themselves. Because I do know what Health Assist, you have a whole lot. I know what you're doing. And I just want you just a little bit, I'm not going to hold you much longer, but I want you to kind of just elaborate, just a breakdown, a bullet point, everything you do. Because real quick, bullet point, what you do, so they have an understanding. Because sometimes people may see these broadcasts and they only heard what they want to hear, and they waiting to hear it again. Well, she's going to say it again. She's going to say it again. We're going to ask you to say it again.
That's
just a bullet point, everything that you do on bullet point, and then give her your phone number again so they can have that.
Okay. Before I say that, Pastor Coles, if I may just, I know you mentioned what we're doing in the community, but I do want to emphasize that it's been the collaboration and the partnership. Like, for instance, with you allowing us to be on this show today, with Oakmont allowing us to serve the medical students, and us coming together to really serve the people. It's really been that partnership and the collaboration that makes it effective. There's that saying, it takes a village, and to really help the people. And so that's, when I think about what I do, it's really what we do together. Amen. Collectively to help the people and the individuals in the community. And so what's made it work is, I personally, I'm at every free clinic, partnering with the providers and the medical students and, who's there to serve. I partner with, I also do provide case management services. And so, when an individual comes in and may be in need, we want to ensure that there's follow-up and that they understand that we do care and that we are here to meet their needs. I work closely, again, the partnership with all of us in Health Assist. And so if it's calling Bernstein, the case manager there, or, Lisa, or medication assistant, hey, Crystal, can we get them their medicines for free? That's what we're doing. But it's always not what I'm doing by myself.
Amen.
It's what God has given us grace to do together as a partnership. And so that's why I'm so appreciative for this opportunity. And, because really it's what everyone is doing in the community to make this work.
Wow. Well, we truly want to thank you for the hard work that you're doing. You're right. It takes all of us to do it. It's like, you look at sometimes the word members, and I believe my fingers is the member of my body. I need my foot. I need my eyes to see. And
Absolutely.
brains to work a little bit, eat plenty of bananas. But I do want to say we thank you for sharing that information, understanding it does take us all to come together. I really believe in collaboration.
Absolutely.
Because I know that I can't do the ministry the Lord have given me to do. And again, it's not even our ministry. It's that we do it and the Lord have somebody else to replace us.
Yes.
So I truly want to thank you for being on the show. If you can give me your number just one more time and we ask the closing. If you give me your phone number one more time as we closing out.
Absolutely. 252-847-7016, or the main Health Assist line is 847-2821.
Again, we thank you for being on the show.
Thank you.
Please share the information that you received today. Give her a call, especially for the churches. If you can help, please help. We all need each other, as she said, to make it work. God bless. Thank you for being on the broadcast.
Thank you.